assessing the mission of the United States Department of Health and Human Services, otherwise known as HHS, by Heerak Christian Kim, Master of Science in Nursing, Master of Education, Registered Nurse, Clinical Nurse Leader, Certified Nurse Educator. The starting point for assessing the mission of the United States Department of Health and Human Services, HHS, is understanding what mission statement should include. The mission statement should be adequate in coverage, specific in focus, and achievable in time. The mission of the United States Department of Health and Human Services is stated as the mission of the United States Department of Health and Human Services, HHS, is to enhance the health and well-being of all Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences, underlying medicine, public health, and social services. Examining the mission statement for effectiveness involves specifically breaking down words and phrases and analyzing their denotation and connotation. The mission statement must convey what the organization wants to do effectively so that workers as well as patrons can understand exactly what the mission statement is stating. The first element of the mission statement is to enhance the health and well-being. There are three keywords: enhance, health, well-being. Let's look at each of these words carefully. Enhance means to improve and implies improving upon the current status quo or current situation. Improvement is seen as a motivation of individuals. The object of enhancement or improvement is health and well-being. Health refers to the physical condition that can be tested through diagnostic and lab tests. Health is assessed objectively through evidence-based assessment tools. On the other hand, well-being is a state of emotion. So well-being is how one feels. A person being sad can imply that the person is not in a state of well-being, whereas a person being content implies a state of well-being. The next phrase of all Americans points to those who are citizens of the United States of America. It is a matter of legal status. In the United States of America, there are two ways of becoming an American citizen. One way is to be born in the United States. Another way is to be naturalized as an American citizen after obtaining a green card or permanent residency status. Since the United States Department of Health and Human Services is a government agency, it makes sense that there is an explicit statement of providing service to U.S. citizens because taxes pay for Department of Health and Human Services. The U.S. Department of Health and Human Services will enhance health and well-being of Americans by providing for effective health and human services. So what does providing for mean? It can refer to directly giving. In other words, the United States Department of Health and Human Services can operate buildings that give services directly to United States citizens for the purpose of enhancing health and well-being of U.S. citizens. But by providing for can also refer to ensuring or using a third-party vendor to give services. Because the United States of America is a big country, the United States of the Department of Health and Human Services, HHS, can contract out services to independent contractors or pay entities that provide services on behalf of the U.S. Department of Health and Human Services. As a part of their mission, U.S. Department of Health and Human Services wants to provide effective health and human services. Effective means that services will work. But effective is a tricky word because it can mean different things to different people. But the word effective is meant to convey the successful target of the mission of U.S. Department of Health and Human Services. The wording in the mission is to allow the U.S. Department of Health and Human Services to have the greatest latitude to define what health and human services provides. The breadth allows the government agency to define and specify according to their own resources, limitations, and political trends. As a tax-funded government organization, the U.S. Department of Health and Human Services activity is limited by federal government decisions. U.S. Department of Health and Human Services wants to portray itself in a parenting role, so the mission statement utilizes words associated with parents, such as fostering. Fostering is a synonym for encouraging. What does the United States Department of Health and Human Services want to foster? The United States Department of Health and Human Services wants to emphasize its dependability and trustworthiness, so it uses words like sound and sustain. The word sound implies that it is dependable. Sustain means that it is not fleeting or short-lived, but that there is a type of longevity or even permanence to the positive work of the U.S. Department of Health and Human Services. The word advances point to constant progress that the U.S. Department of Health and Human Services wants to achieve. The U.S. Department of Health and Human Services wants to emphasize its connection to objective science as a foundation for its operations, which explains the emphasis on the sciences. The U.S. Department of Health and Human Services states that the science underlying medicine is first because the field of medicine is considered the leader in healthcare sciences. In terms of functional hierarchy, the medical doctor is seen as being the leader of any healthcare team in the hospital. Thus, nurses take orders from medical doctors and execute them as well as other members of the healthcare team. The U.S. Department of Health and Human Services, HHS, lists public health after medicine because as a government agency, the U.S. Department of Health and Human Services, HHS, is tasked with ensuring public safety. Taxes fund the U.S. Department of Health and Human Services for this very purpose. The U.S. Department of Health and Human Services lists social services last because it prioritizes immediate health needs first by emphasizing medicine and less immediate needs related to life and death last. But the rationale may not be the best since social services such as providing food stamps for the poor may also be a matter of life and death. Furthermore, providing for disease prevention through food and shelter are important services related to health. To review, the mission of the United States Department of Health and Human Services is to enhance the health and well-being of all Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. U.S. Department of Health and Human Services mission statement can be improved upon, like most mission statements, for clarity and for understanding. Problematic words can be improved to make the mission statement more clear, are marked in red, and they are enhance, providing effective, fostering sound, sustained advances. To improve the mission statement, the word enhance can be changed with improve and providing with good. The whole phrase fostering sound sustained advances is awkward and tortuous, so the whole phrase can be changed to advancing, which is clear and concise. The mission statement should not be confusing to the people that the U.S. Department of Health and Human Services is serving. The new mission statement reads, the mission of the United States Department of Health and Human Services is to improve the health and well-being of all Americans by delivering for good health and human services and by advancing in the sciences underlying medicine, public health, and social services. The new improved mission statement makes it clear both to employees of the U.S. Department of Health and Human Services and the people the federal government agency serves, so that there is no confusion about what the federal government agency is intending to do, reducing stress and misunderstanding by clarity and simplicity of the mission statement actually achieves the wellness that the United States Department of Health and Human Services strives for reducing complexity, reduces time needed for clarification, and energy spent trying to clarify. The new mission statement is therefore a win-win mission statement for the U.S. Department of Health and Human Services. These are the references for this presentation. And it is important to improve mission statement for clarity and understanding, not only so that the mission statement can be understood, but that it will give a more direct pathway for strategic planning and for implementation of its strategic plans in real time and in real place to real people. I hope that you enjoyed the presentation and that it provides you with some important insights and food for thought.